Yeah, I am Dr. N Upendra Kumar, Senior Consultant Urologist, KIMS Hospital, Secunderabad. Today we will discuss about the dialysis. What is dialysis? What are the types of dialysis and when you should start dialysis? Actually, the dialysis word means filtering of the blood. Most of the patients who are chronic kidney failure patients, who have chronic kidney damage, they depend on the procedure called dialysis. Dialysis is nothing but an artificial kidney. So once the patients the kidneys of the patients who are having kidney failure cannot filter the toxins which are in the body, the waste products and the water. So this is the best alternative where the function of the kidney is taken up by this dialysis. So dialysis has a membrane which filters the blood, which filters out all the toxins, and then the blood again is pushed back into the circulatory system. So in this, actually dialysis is of three types. Number one is hemodialysis. That means the blood is filtered through a membrane and the toxins are removed, and again the blood goes back into the circulation. Second one is peritoneal dialysis. The peritoneal dialysis can be two types. It can be ambulatory peritoneal dialysis or cyclic peritoneal dialysis. So there are two dialysis. So this can be done by using the normal body layer, that is called peritoneum, that is in the abdomen. The layer is used where a fluid is put into the abdomen, kept it for 3 to 4 hours, exchanged, and then again removed from the body. This is called natural way of dialysis, called peritoneal dialysis. So how do the dialysis is done? The dialysis is done by means of three techniques. One is arteriovenous fistula. This is also called AV fistula. The other one is arteriovenous graft, and third one is the subclavian line or perm cath. So there are three ways of doing dialysis. So in this, AV fistula means a vein and artery are combined in the arm or in the wrist, and through which the blood is taken out from the body, filtered in the machine, and again taken back into the body. So this is called hemodialysis through AV fistula. AV graft, in those whose the arteries are not very good, so in that we take a graft from any other vein like great saphenous vein, and it is put to bridge the artery and vein. So these are some of the accesses by which the blood is circulated out into the machine, and then the machine takes back the blood after filtering it into the body. So what are the indications for hemodialysis or peritoneal dialysis? Basically, patient having chronic kidney failure with elevated potassium, that is normally the potassium is around 5. If potassium is very high, that is also called hyperkalemia. That is one condition. Second thing, if the patient is having uncontrolled hypertension, if the BP is uncontrolled, this patient definitely requires dialysis. Third one is if the patient is having diffuse edema, also called anasarca or pedal edema or facial edema, this patient definitely requires hemodialysis. And lastly, patients having the creatinine very high, so those patients more than 8 or 10, they definitely require dialysis. Apart from this, patients having acidosis, severe acidosis, that means it's also called metabolic acidosis, these patients also require dialysis. And lastly, patients having severe breathlessness, patients have water in the lungs, this is also called pulmonary edema and effusion, that can also lead to difficulty. So that is one of the indications for dialysis. So these are all the indications for dialysis in patients having chronic kidney failure. So any of these problems, if the patient develops chronic kidney disease leading to end stage renal disease, the dialysis is given once like thrice weekly, alternate day has to be taken. If the patients who have a milder type of kidney failure, they may require once or twice in a week. So, and the patient should never miss a dialysis, because as I said, all these complications can lead to death of the patient. So it is very, very important that the patient follows the doctor's advice and keep the dialysis being done regularly, alternate day basis, and till the kidney transplantation is due. Like if some donor is ready, then they can go for an ideal replacement is kidney transplantation. So the dialysis is a temporary part of the kidney failure till the patient gets the donor. So the dialysis also need to be done very promptly. And the other type of dialysis which I was telling is peritoneal dialysis, where there is a peritoneal fluid which is exchanged in the abdomen 3 to 4 hours, and 3 to 4 exchanges per day has to be done. So dialysis is a replacement of the transplantation temporarily, and it is nothing but the artificial kidney. Thank you.